Yeah, we all just go.
Okay. So of course we would have his feet supported if we could. So Robert, you're going to want to come to this side so you're getting the goniometer. So for flexion and extension, you want to make sure that he's sitting up nice and straight. He looks actually pretty good. And you want the red arrow pointing to 0. Okay? Now what I'm going to have you do is bring your chin to your chest. Okay, and now we're going to read the goniometer, and thankfully for me it's at 70, so come on back up. So his forward flexion is 0 to 70. Okay, now what I want you to do is bring your head back, look up at the ceiling. And now he's at 0 to, go ahead and come back up, is it 0 to 66. Okay, the goniometer norms are 0 to 45 for each of those, but we're not using the goniometer, we're using the CROM. Okay, but do you see how easy it is to do flexion and extension? That's so nice. For lateral flexion, we're going to come here, and now we're going to use this needle, right? I don't know what I'm going to do to get that out of my mouth. What I want you to do is bring your ear to your shoulder without bringing your shoulder up to your ear. So, and come on back up. So is it 0 to 48? There's a lot of ways to cheat on that one, so people will tend to rotate their head. You really want pure plane motion to the side. Okay? Go ahead and go off to the other side. And he's lopsided, right? He didn't go quite as far to his left than he did to his right. And come on back up. Now for rotation, I'm going to have you sit in the chair. Go ahead and sit. So these two needles are inclinometers. They're just pointing straight down. Okay? On the top is a compass. So what you want to do is when he is sitting nice and straight, we're going to turn this needle so that it reads 0. Does anyone want to come look at it, or do you have it? So I can just turn this. 0 happens to be facing generally the way he's facing, but it doesn't have to be. Okay? In fact, let's just make it so it's not, I'm going to turn you just 45 degrees, but I need you to stand up. There you go, now sit. There you go. So now, north is still that way, right? But all I do is just 0 this out. Okay, so this outer ring turns. So regardless of what's north, I just make that 0. Now turn and look over your left shoulder. So I'm getting 0 to 72. Come on back. And now go over your right shoulder. And now I'm getting 0 to 48. So go ahead and come back. So he has some asymmetry there. But do you see how I can get all 6 motions really super easily?
You would just say like rotating left, rotating right, side bending to the left. So how would you document that?
Yep. Rotation left, rotation. Yeah, I'll document all of those for you. Okay. Thanks for reminding me because I wouldn't have otherwise probably. All right. For cervical range of motion, we tend to not measure passive range of motion. We only measure active range of motion. Okay. So this is the CROM. We have 4 of them. Make sure you practice with it. Moving arm is going to be on a line from the earlobe to the nasion or the base of the nose. Okay? So again, I want to make sure he's positioned well. For all of the cervical ranges of motion, we typically do it in unsupported sitting, although we would have something under his feet. So we're going to come in here. Okay, and go ahead and forward flex for me. I don't know that. Come on back up. So we have 0 to 49 degrees. Extension is going to be the same. There you go. So we're here, and go ahead and lean back for me. Okay, and relax. So now we went from 90, we went to 10, 20, 30, 40, 50, 4 degrees. okay, because I went from here to here. Right? Because everyone is here, can you sit cross-legged with your back to us? This is not normally how you'd have your patient position. There you go. For lateral flexion, you're going to have your stationary arm along the spine. So first I have to find C7. I don't palpate through clothes. That's just for you.
Thanks.
Okay, so it's right there. So in your kits, you have body pens. This would be one that I would mark with a body pen. Okay. Not crazy notes. Although I did have, well, my video's running. All right. So,
I can turn it off.
no. Okay, so now I have it lined up here. And I want you to bring this ear to this shoulder. I don't either, Siri. And come on back up. So that's how you're going to measure lateral flexion. Okay? So you had 0 to 41 on that one. Can you see that that angle is just not, goniometers don't make a whole lot of sense. The last one we need to do is rotation, so maybe you have a seat back in the chair with patients, but if you're on a low mat table, you can. So when you're practicing this, make sure you practice it with a person in a chair, not that they're sitting up on the plinth and then you climb up on the plinth to do this measurement, okay, because that's not how we would do it in the clinic. So here, the stationary arm is going to be through a line drawn between the two acromions. Right? I'm not sure if that's acromia or not. I think not. Does anyone know Latin versus Greek? I just learned that octopuses is actually octopuses and not octopi. It's quite sad. I like saying octopi. All right. Now, Victor, I'm going to have you turn this way to your left. Okay, come on back. So we went from 90 to 10, 20, 30, 40, 50, 66 degrees. Okay, now I'm going to have him at 90, and if he turned the other way, my goni would go this way. Whether you have the stationary arm this way or this way should not matter.
And where you,
Okay.
I'm sorry, where did you say you're focusing on?
My stationary arm is on a line between his two acromions, and then the axis is going to be the midpoint of the acromions, and then I am keeping this bisecting his head. Okay? You want to be a little bit careful to use people's noses. All right? Yep. Because noses can be crooked. Okay? So we talked about 3 methods. By far the CROM is the easiest. For the tape measure, you're either using these locations for lateral flexion. I'm sorry, these locations for lateral flexion, these locations for rotation. Okay? Gina?
Sorry, and you said for the exam we get to pick which way we want to do
Yeah.
it. So we, out of these 2 methods.
Yeah. Now, you still should practice all of them and know all of them, but yeah. Now for the goniometer, remember that for flexion, the arm is vertical, the moving arm is lined up with the earlobe and the nasion. You're going to put the person in the position that makes that the neutral position, okay? And then you're going to measure flexion and extension. For lateral flexion, the stationary arm is along the spine, the axis is on C7, so you'll have to find C7, and the moving arm is bisecting the head. He's now a little crooked. For rotation, you're going on the top, and the stationary arm is on a line bisecting the acromia. The axis is in the midpoint, and then we're bisecting the head.
So that
Okay.
doesn't necessarily have to be 90, or do you want to move it?
I will typically get him in a position where he's at 90, yeah.
Okay.
Now, the one thing I don't like about the tape measure and the goniometer, in addition to all the things I've already said, is when I'm doing those, I don't get to watch his movement. Whereas with the CROM, I can watch the quality of his movement and then get the measurement because it's the least effortful for me. So if you do choose to use tape measure or goniometer, I would like you to just watch the quality of movement before you take the measurement. Okay? When you're treating people with a spine problem, it's the quality of the movement that's going to be so much more important than the quantity of the movement. Okay?
Yeah, so, you get to choose, because it reminds me of muscle length testing if I'm measuring with the, you just have to state in your documentation it's, centimeters instead of like an angle.
Right, exactly. And even with goniometry or the CROM, those are going to be in degrees. You need to indicate goni versus CROM. Okay? So while you're match, okay, and I'm at 13.2. Now I'm going to have you go ahead and come down. Bring your chin to your chest. Okay, and now we're at 5.2. So 13, go ahead and relax. So that's 8 centimeters. So I'm going to document flexion as 8 centimeters.
Because that's, you want to keep them in like they're doing a chin tuck, right?
Right,
Position, so
right.
they can't.
Exactly. And he did well with that. So now for extension, I'm going to come back. I'm here again, and I'm going to have you go ahead and bring your head back. Look up at the ceiling as high as you can. But do you see how I'm letting the tape just go? And go ahead and relax. So our starting position was 15.2? 13.2. And now I'm at 23.9. So I would have to do that math, and that would be extension. Okay? For lateral flexion, I'm going to use the most lateral aspect of the acromion and the mastoid process. Okay, so I'm at 24.2. Go ahead and bring your ear down to me. And now I'm at 18.8, and come on back up. And then I would do the same thing on the other side. Okay? Now again, what you're noticing is I'm keeping the tape at the proximal attachment, and I'm letting the tape do whatever it needs to do on the distal side. But what I'm not doing is pulling my hand off and then going back in and measuring. Okay? So for flexion and extension, the landmarks are the base of the mandible to the suprasternal notch. For lateral flexion, it's mastoid process to the most lateral aspect of the acromion. For rotation, we're going to combine those, of course, just to be confusing. We're going to go from the base of the mandible to the lateral aspect of the acromion. Okay? So here, what I'm going to do is start there. So I'm at 26.2, and go ahead and look over your right shoulder. And now I'm at 15.5, and come on back. And then I would measure this way for the other side. Okay? They should make some sense, right? We're using the same landmarks, just in different combinations for the 6 motions. Okay? Can I go ahead with goniometry? Are these simple enough we can move forward?